Jerry, welcome back. I'm sorry you had to come back, but yeah, you're right. You're in good hands if you come back. That lesion on the side of your face that we did in an earlier video that people can go back and watch if they want. Right. You like the way I throw it in that little direction there to keep the channel. Yeah. It is a YouTube channel after all. You guys are watching. The lesion came back showing nodular and superficial basal cell carcinoma, type of skin cancer, and we do need to get rid of all of it. It wasn't completely clear in the margins, so I spoke with Dr. Trauner, the surgeon we originally were going to send you to, and he said, well, first of all, he's the one who said we had to have a biopsy in order for him to treat you, and then he said, any remaining basal cell, the way to get rid of that is real simple. You use an instrument called a curette, and you scrape on it fairly firm, and you take off everything that comes off easily with the curette, because the curette really only takes off cancerous tissue, not healthy tissue.
Very good.
Then you cauterize it, then you do it again, then you cauterize it, so you do these 3 passes just right after another in succession. This is the instrument, it's called a dermal curette, and it's not super sharp, so it's not going to cut into normal tissue, but it does scrape away the dead tissue. We'll use that. Most surgeons will use electrocautery, the little electric current thing that you see a little bit of the current passing through a little arc, and it smells like burning flesh. We don't use that here. We have one that's called chemical cautery with silver nitrate. Okay. We still have to keep an eye on it even after doing this treatment for it, because it can come back after any treatment. Yeah. But this is a very effective, simple, relatively inexpensive treatment.
Okay. Can I say thank you to all the viewers for the past videos?
Oh, you saw what they wrote, the comments?
I did, in the comments, they were awesome.
Okay, so do keep commenting to Jerry.
Yeah. They were, I mean, perfect strangers said the nicest things, encouraging words, and thank you.
Okay, good. Nice. Yeah, it's kind of cool to do it, isn't it?
Yeah. Be awake for this,
This is the part where we put it out. Somebody get the wrench. It's a big crescent wrench.
I can do that anywhere, anytime.
Here's the shot. And get this entire area. Ready? Sorry. Oh, you've been through this once before.
It really doesn't help.
So putting in some anesthetic, lidocaine 1%, with a little bit of buffer. And I'm going to numb up quite a broad area here. I don't want to go too much in the ear because I am using epinephrine. But we do want to get all the area that the curette takes off. So we'll do a rather large area. And the way this curette works is only the stuff that's supposed to come off does. Do you still feel it?
No, not really.
All right.
I'd tell you what, it was really strange when I left here last time, though, because my ear was numb.
Yeah.
And hearing things, and it was like my equilibrium was off a little bit.
It is a strange thing.
Strange.
So this is to keep the blood from blocking the ear, because it will bleed down into the ear canal.
Oh yeah, it did exactly what you said it did.
Yeah. Epinephrine's helping to limit the bleeding. Here we go. Curettage. So it's a scraping. And normal skin doesn't come off.
That's amazing.
But there is a feeling that the operator can feel, that being me, when it's going over the cancerous tissue. You can feel it coming off. So I'm going all the way to the edges that we... Can you feel it?
I can.
Yeah, you can feel that roughness, the scratchiness.
And then it goes away as you get it off.
So that tells you where the cancer is and where it isn't.
Amazing.
Pretty cool.
Yeah.
Still scratching.
Mm-hmm. But you can tell it goes smooth when you do get it.
All right, so we will
didn't see any light shining through there.
The light shining through.
Didn't have to go that
We didn't go that far, no.
Cool. It starts.
This is where the screaming starts. I'm pushing kind of hard. The reason I'm pushing hard is to push all the blood out.
Okay.
Because cautery doesn't work well in a wet environment. All right. So that's one. And then we go through again with the curette. And start scraping again.
Why don't you just do it with one scraping?
Why don't we do it with one scraping?
Yeah, because it gets too bloody.
I actually don't know the reason. That the standard is to do several, to go back and do it 3 times. My assumption is that somewhere in the studies, somebody found that it's more effective to do it 3 times than to do it 1 time. But I actually haven't gone through that part of the literature myself. I've just gone through the textbooks that say this is the standard way of doing it. And what's interesting is the curette is not taking off some of the area where we did the cauterization. That is so cool that you read the comments. I think you're the first person to say something like that.
No, my daughter actually showed it to me.
She showed you all the nice things they were saying? All right, let's get that. Pushing really hard on you here. And yeah, you can feel it there.
Mm-hmm. It's about the size of a pencil eraser kind of area.
Oh, it's even smaller than that. It's just 3 millimeter, very small. That's why I have to do it a bunch to get the whole area, because it is rather small. See if I can empty it out here into the...
And you use a new tool each time?
No, I'm using the same one. Yeah. Same patient. Same lesion, same tool.
Gotcha.
They're disposable, so I'll throw it away after. Sounds like we're getting a lot right here. It's not bleeding heavily, but of course we have epinephrine in place to help keep it from bleeding a lot. All right. We're going to do the cautery again. Yeah, I'm glad it's not bleeding a lot.
It's pretty much right on the surface.
It is. It's very superficial. Partial thickness, as they call it. All right. Number 3. All right. Yep. Same place.
I can feel it.
Yep. And that is the area where there was a little crust on it. spot.
It seems pretty stubborn.
It does. I would agree with that statement. Let me clean it out a little bit.
How's it feel?
Yeah.
Fine.
I'm going to go around it, but not go inside of that cut. Just roll over it on both sides. Let that. We're just going to let that close over that. I'm not going to put any stitches or anything, just let that close. Thanks, Jerry. We're going to have to keep a really close eye on that because that actually was open and I can see your cartilage. That's not the way it's supposed to happen, but it's going to heal. But because of still having that scraping right up to the end, I do have concern that there's some tissue there that it may not completely get rid of. Chances are it will. The dermatologists say that when you do that much, even if there's some scraping, just because of the damage to the tissue, it doesn't usually survive, but we'll keep a close eye on it. 6 weeks, recheck. Hey, if you enjoy this, go ahead and make comments to Jerry because he reads them.
I read it.
That's right, he does.
I enjoyed that.
If you want to see behind the scenes material like Boo Boo Kitty, Lindsay Antwine, and Petra Rosenberg, be sure to hit the Patreon link. And if you haven't already subscribed, please do that. Until next time, Jerry and myself telling you to stay in good health.